Hi, it's Dr. Tracy again. As promised, I am going to talk specifically about a type of cancer that I commonly see in my line of practice, which is unfortunately end of life. It is mainly just for dogs. I will hit up another disease for cats in my next video as well, but I'm going to talk about hemangiosarcoma, or HSA, which is a type of cancer that we see in a lot of our large breed dogs, although our small dogs are not excluded from this as well. It's a type of cancer that tends to arise on mainly the spleen, but we can also see it on the liver, the heart, and we can even see it as a skin tumor to start as well. So what is hemangiosarcoma? It is a highly aggressive, malignant, meaning that it likes to spread very quickly type of cancer. It arises from the cells that line the blood vessels. Again, it most commonly affects the spleen, liver, heart, as well as skin. You can find some actual hemangiosarcoma tumors that start in the skin in dogs. I unfortunately have had 4 different labs that have had each kind of hemangiosarcoma, and each one had a very different presentation as to how I discovered that they had it. Unfortunately, this disease is really expensive to treat. It's very aggressive, and a lot of times by the time people tend to find it, it is already spread or it is already causing a lot of damage to your dog. Therefore, many times treatment isn't even an option for some of these pets. In early stages of hemangiosarcoma, generally our pets do just fine, so you won't even know it's there unless you go looking for it and doing routine needle aspirates on any masses that you find on your dog, doing routine x-rays, and more commonly it's found on ultrasound, where they do an actual ultrasound of the liver and spleen and make sure there's no masses. You're not even going to know it's there. To be honest, my first dog that I had found a little tiny mass on her hip. I brought her in for a dental cleaning, had the mass removed, and lo and behold, it came back hemangiosarcoma. I was devastated. I went in and I had one of my friends do an ultrasound on her and do some aspirates on her, and they found a couple masses on the spleen, but she was older, so they thought it may not be anything. They sampled it and it looked a little suspicious, so I immediately went to surgery to have her spleen removed because that's where they found it next. And it came back as hemangiosarcoma. To be honest, until she actually started to have problems with her tumors because it wound up spreading to other areas of her body, and actually all of my dogs, they did great until the tumor usually ruptures, and then that's when we see a sick animal or a sick dog. So a lot of people ask, how can I prevent this? Honestly, we don't know. It can be a genetic component. We see that German Shepherds are hunting breeds like Labrador Retrievers, Golden Retrievers, Pointers are more prone to developing this, although I have seen it in every single breed of dog. I even saw it in a little miniature pinscher, which is hardly ever seen in, but you can see it in all sorts of dogs. They wonder if sun exposure has something to do with it. My black lab loved to lay out in the sun, and you know, that was the kind of the hip shit she always had up, and maybe that's where the tumor started. I don't know, honestly. She was an older girl, so unfortunately cancer does tend to pop up as our dogs age. So that's another factor that we tend to see it. We usually see it in anywhere from 8 years up to 12 years of age is the average. However, I had a black lab who had it on her heart at age 2, where it ruptured and she died suddenly while she was running around on the beach. And we didn't even know it was there until we diagnosed it afterwards. What are some of the symptoms that you can see with hemangiosarcoma? Unfortunately, usually we don't even know it's there until it's pretty far advanced. So a lot of times when it's advancing, we see dogs that seem to tire out more, or maybe they're just a little off of food. They can have some more rapid panting breathing at exercise, or they can't even do the stuff that they used to do. Some of our dogs will do this odd little stretching thing. I had one yellow lab named Madison who I noticed before we diagnosed this that she seemed to stretch. She did the downward dog yoga pose more often. And I was like, oh, that's odd. Or when she'd go to get up onto the bed, she'd kind of do a little stretch where she never had done that before. And I think honestly, she had it on her liver, so maybe it was a little more uncomfortable and she was feeling a difference there, and that's why she did the stretching. But usually, like I said, it's usually we're seeing it once these masses have ruptured, because what they do is they're just kind of there on the liver, the spleen, the heart, wherever they are, and then they'll just slowly grow, and then all of a sudden they outgrow their blood supply, or they outgrow like the coating, or they outgrow the viscera that's sitting around it, and they rupture. And once they rupture, that is when you see the major problems. So we can see anything from a huge distended abdomen to panting, to pale gums, to a dog that's got that drunken staggering walk because they're really weak, to nosebleeds, lots of different symptoms. Once we see those, that's an emergency and they need to go in right away. Hemangiosarcoma is generally diagnosed via an ultrasound. Your vet may run some blood work right away to see where your pet's red blood cell count and platelet count are at, especially if they're seeing a big distended belly. Sometimes they'll even stick a needle in that and pull out some fluid and they'll see blood. So they want to check to see how stable your pet is. So a full panel blood work would be ideal for you to allow your vet to do. A lot of times they'll also take x-rays, and if they have an ultrasound, they will stick an ultrasound probe on your pet right away to see if they can find where the tumor's at and what's causing this bleeding and this weakness in your pet. A lot of times other imaging like MRIs and CT scans aren't needed until later on after a diagnosis is made. You can sometimes get a diagnosis by doing a little fine needle aspirate, where they take a little needle, a little syringe, and pull out some cells of the mass that they find. It's usually guided via ultrasound, and they can find the hemangiosarcoma cells. A lot of times it's diagnosed if you have a splenectomy or have the spleen or a section of the liver removed, because there is a bleeding tumor. They'll be able to diagnose it off of that. But generally, a tentative diagnosis can be made just by symptoms alone and by the diagnostics that your veterinarian can run in a basic animal hospital without going to a referral center. Hemangiosarcoma is treated mainly via surgery. So if there are tumors on the spleen, if there's tumors on the liver, it's removed. Tumors on the heart, generally they aren't able to remove those. It's just too dangerous and it's way too expensive. We don't have the surgical technology that they have in the human medicine, so it is very rarely done, if ever. If you find hemangiosarcoma on the skin, they'll remove that as well to try to help prevent metastasis or spread to other areas of the body. Although, just like my dog, generally, I mean, I found that tumor probably with 3 months before I removed it, and it was already in her spleen. Probably should have moved a little quicker in hindsight, but everything's easier in hindsight, isn't it? If your family chooses to go the route of having the tumor removed, the next follow-up that you would do is usually really aggressive chemotherapy, on occasion radiation therapy, depending on where the tumor is located, and if they thought that there was spread to certain areas. It is a very good option as well to do supportive care, and many times your vet will say, you know what, we can do all this stuff, but the survival time is probably not going to increase by much because it's already too far past being able to do that, which is unfortunately most of the cases. So I tell people, don't feel guilty about missing this. I mean, it was missed by me twice on 2 of my dogs. If you don't go looking for it in an old dog, you're not going to find it. So don't beat yourself up about that. But a lot of times we are turning to supportive care, which is what I'm going to cover next here. So the first supportive care, which is more aggressive, if you brought your pet in right away and they were anemic, the first thing they may do is a blood transfusion. Now, please be aware that a blood transfusion is only a temporary fix. If you do not remove the tumor and it continues to bleed, you are going to be right back where you started in a very short time. Our pet's body tends to cycle through the red blood cells within a 4 to 5 to 7 day basis. So honestly, if you do a blood transfusion and your pet is continuing to bleed the amount that they were to cause the need for that transfusion in the first place, you are most likely only going to get about a couple days to a week's time extra because of that transfusion. So that is a conversation that you should have, one with your vet and also with your family, before you pursue that, because that is a pretty expensive endeavor to go to. So if your family decides that they don't want to pursue surgery, chemotherapy, etc., your vet will probably pursue more palliative care. The first thing they do is they'll probably put your pet on pain medications. This is just to cover all of our bases. To be honest, when I watched my first and second dog go, or first and third dog go through this until that tumor ruptured and they started seeing more painful in their abdomen. They were fine. My first dog actually was swimming and jumping off the dock at our local lake the day before her tumor ruptured, and then she went downhill really quickly. And when I knew she was refusing to eat bacon and she was panting heavily and she seemed really weak, it was time for her, and that's when I decided to put her down. From start to finish with Sadie, who was my first dog, I actually did pursue a splenectomy with her, and then I went into a clinical trial with her of chemotherapy that I brought her down to actually Madison, drove 8 hours to get her there for her clinical trials because I was in vet school and I didn't have the money to do that, and most of the clinical trial was free. After her 6-month recheck, they had already found that the tumor had spread, so they discontinued her from the clinical trial. I then did some more different chemotherapies that weren't in a clinical trial that were known to help with hemangiosarcoma, and 2 months later it had spread to her kidneys as well. So from start to finish with her, I got about 11 months with her before her tumor ruptured and she was really sick. We did find this extremely early, so honestly your progression is very different depending on what stage you find this at. If you find it very early and you decide even to pursue more aggressive therapy like I did, it is no guarantee that you're going to still have your dog in a year. There is a chance that you may not. And every dog, like I tell people, they don't read the books. So unfortunately, one dog may do one thing and another dog may do something completely different. On average, you're getting anywhere from 9 to 12 months when it's first diagnosed, pursuing just palliative care. If you're finding it where it is already quite advanced and there has already been history of a bleed and you've got a dog that's got anemia, it can be anywhere from hours to days to a couple weeks to a month or two tops. Generally it depends on what kind of bleed they have. My second dog had it on her heart and she died instantly and there was nothing I can do. My third dog, Madison, she actually had an immune mediated reaction about a year before, which I think was the very beginning of her cancer. I treated that and got that all under control and she was doing great. And then I started to notice the stretching things and everything like that about 9 months later, so about the same progression as my first dog, Sadie. And then once she had a smaller bleed, so she had an episode where she was really weak and just kind of lethargic, and what I think is she had a smaller bleed. It was able to close itself off. She recovered, and then I would say about a month to a month and a half later, she had a big one. And it was before I had my home euthanasia service. I had to actually rush her into the emergency clinic, and she went downhill in a matter of like almost 2 hours. I barely got her to the emergency clinic in time. So unfortunately, these animals, I tell people they're like a ticking time bomb. None of them read the books and none of them follow the rules. They're all very different. So you have to prepare your family for this. This could become an emergency situation if you decide to wait until they're really, really sick to put them down. So other medications that your vet may decide to put your pet on, sometimes they'll put them on steroids. As long as your pet can tolerate the side effects of steroids, it's certainly not going to hurt them to put them on a low dose of steroids. It might help with the anti-inflammatory. It can also help with a little bit of pain because it does have anti-inflammatory effects, etc. It all depends on how they tolerate it. We don't know if it truly, I mean, steroids do have some anti-cancer effects when, and they are even used in some chemotherapy treatments with animals, but we don't know if it really truly works or not, but it's certainly not going to hurt, especially if you're just doing end-of-life palliative care. Another medication your veterinarian may prescribe is Yunnan Bio capsules. These are anticoagulant herbal medications that seem to help with bleeding. So especially if your animal has had a sudden bleed, there is a very good chance that your vet is going to put your pet on this. There are a few other herbal supplements and immunity support medications that they might try as well. And it just depends on if your pet will tolerate it or not. Most commonly, we see them going off of food and having diarrhea from this, but honestly, if you adjust the dose, most pets do quite well on it. Some veterinarians may also prescribe some CBD products. It's certainly not going to hurt. And honestly, I tell people everything helps. So at this point, as long as your pet tolerates it, it may have a good side effect of making your pet more comfortable, decreasing inflammation, helping with appetite, etc. Don't be surprised if that's kind of the new up and coming drug if they say, you know what, you can go over to your local Chuck and Don's or your local PetSmart and get that as well. So I also have a lot of people say, okay, my vet just said that my dog has hemangiosarcoma. They are already anemic. They're already having problems. What do I look for at the end so when I know it is time? I will refer you to my quality of life video and trying to determine when it's time. But specifically for looking at this type of cancer, you're usually going to see a big distended abdomen. And that may kind of come and go because your animal or your dog can reabsorb some of that blood. But if they're having a really big distended belly and they're not able to get comfortable, so they can't fall into that really good deep sleep, they're shifting around constantly, unable to lay here or here or here. They're constantly standing to the point of exhaustion because they don't want to lay down and have that belly put pressure on their breathing. That is some signs that your pet's uncomfortable and we need to consider euthanasia. Difficulty breathing, of course. They can have difficulty breathing just because of the anemia. Your red blood cells help carry your oxygen to your body. So a lot of times if your pet is really anemic, not just with that distended belly, but just anemic because of chronic bleeds from this disease, you can see a pet that has that kind of drunken swagger or weakness. They can only go a few feet before they have to stop and lay down, and then they sit there and pant. You look at their gums and their gums are really pale or white. That is a sign of a severe bleed or severe anemia from chronic bleeding. Those are all reasons why we would want to consider end-of-life euthanasia, especially if we're just trying to keep them as comfortable as possible. A lot of times you can also see black tarry stools. You can see fainting from some of these dogs at the very end. If you go to try to feel their femoral pulses, which I also show in my quality of life video, and you can't feel them, that is a possibility too. A lot of these animals, unfortunately, are found, the first time we find hemangiosarcoma, they've had sudden collapse and they're coming in barely conscious. So that's possible for your animal as well. Unfortunately, for these pets, some of them are just sudden death too. I mean, even with a veterinarian, I had a black lab who, like I said, she had it on her heart. I didn't know it was there. It ruptured and she died instantly when she was chasing a ball on a beach. So even the best practices in trying to pay attention to your animal as closely as you can, there is still the risk of your animal just all of a sudden collapsing and dying. This is a really hard disease to prepare for, and every animal is so different that I really encourage people to evaluate quality of life with this on a day-to-day basis. And if you're starting to see a lab, for instance, or a dog that loves to eat, not wanting to eat their favorite foods, not being able to get comfortable, pale gum, difficulty breathing, and you don't want to see a natural death at home, I would consider at that point calling your local vet and getting them in, or trying to call a home euthanasia service to see if somebody can help. I hope this helps. I know this is such a devastating disease. Personally, I know that this is really devastating to have this diagnosis. I tell people that you need to just try to, as best you can, focus on what days you have for your pet. Try to make them the best you can. Create an awesome bucket list for your pet, whether you're going to pursue really aggressive therapy with doing the splenectomies and the chemotherapies, or if you're not, still try to cherish every day. Remember, your dog lives in the moment, and they just want to be happy and with the people that they love. So try to provide that as best you can. Please reach out with any questions in the comment sections.